Alright guys, we're going to talk about the first of two traction splints. We're going to start with the Hare traction splint, which is a dual arm traction splint. They are both utilized, both the Hare and the other traction splint, which we'll talk about in another video, are utilized for a mid-shaft femur fracture. So the middle of the femur between the knee and the hip, either for open or closed femur fractures now. If there is a problem to the hip, the pelvis, the knee, the tib, the fibula, the ankle, the foot, we don't get to use the traction splint. It is only an isolated mid-shaft femur fracture. It'll be identified as an incredible amount of pain, quivering of the muscle, either a closed deformity or the bone sticking out. The leg will be shorter. Yeah, that's how we figure that out. So to get started with this, first things first, PPE, we're going to come up. We may need our partner to take manual C-spine precautions. If we do, then I'll have a partner come up and manually hold C-spine. I'm going to assess my patient's LOC. If they're unconscious, first thing we can do is check for a pulse. If they don't have a pulse, I'll start CPR. For the sake of this, our guy is awake, he's talking, he's breathing, and he has a pulse. So ABCs are intact. I'm going to instruct one of my partners to stabilize the side of the injury. They're going to do like a football hold, so one arm underneath, one arm on top. I'm going to instruct my other partner to go ahead and pull manual traction after I check CMS, so I'll check pulses. Wiggle your toes. Can you feel me touching you? He can, so now I'm going to have my partner go ahead and pull that traction. I'm going to take my ankle hitch, which is a nice little bracelet for my guy to wear. The strap does come off the bottom of the foot so that we can connect it to the hook on our traction splint so that we're able to pull traction. Whenever he is pulling manual traction, he's able to lift that ankle for me so that I can slide this ankle hitch underneath my patient's leg. And then what my partner can do is he can start pulling manual traction from the straps on that ankle hitch so that he's no longer having to hold on to the actual leg there. I'm going to loosen my locks on my Hare traction splint. I'm going to extend this. I'm going to measure it again against the uninjured extremity. We want this to be 8 to 12 inches longer than the uninjured extremity. So I'm going to place it and extend that 8 to 12 inches out. I'm going to tighten down my locks by just turning and tightening my black locking mechanisms. I'm going to go ahead and at this point kind of position where I want my straps to be just a little bit. And I'm going to open all of my straps up so that I'm not manipulating my patient's leg, trying to get these straps undone from underneath his leg. At the very top of it, we do have a small singular strap that is known as our ischial strap. So we're going to place this. I'm going to have my partner lift the patient's leg. I'm going to slide this all the way under my patient. And I'm going to place the ischial strap as high as I can possibly go. Next, I'm going to attach my traction by hooking the hook in. I'm going to twist this dial that is down here until I can pull traction. We are going to pull traction until the injured leg is the same length as the uninjured extremity, the quivering or spasm has stopped in the muscle, and pain has relieved. At that point, we're going to maneuver our straps exactly where we want them to go. On the straps, they are listed 1 through 4, telling you where each strap goes. Number 1 is going to go just above the ankle. Number 2 goes just below the knee. Number 3 is going to go just above the knee. And then number 4 is going to go as high up as we can get it, not to go over the site of the injury. At this point, we are going to reassess CMS. So pulses, wiggle, can you feel me touching you? We will log roll our patient onto a backboard so that we can buddy splint the legs and support everything. And that is how we will transport them, is on a backboard. That is the Hare traction splint.